Welcome to today's episode where we dive into the transformative world of chiropractic care for
Mhm.
whole body health. I'm your host, Njadika Olatunde, and today we're exploring how chiropractic treatments go beyond just alleviating back pain to enhance your overall health and vitality. Many people think of chiropractors as just back doctors, but their role is much more comprehensive. Today, we'll uncover how chiropractic adjustments can improve your nervous system function, boost your immune response, and even enhance your mental clarity. We'll discuss the holistic benefits of chiropractic care, including its effects on stress relief, posture improvement, and how it can be a pivotal part of preventive health care, from reducing dependency on medication to promoting natural healing. Chiropractic care offers a gateway to a healthier, more balanced today. So, whether you're a longtime advocate of chiropractic care or just curious about its potential impacts on your health, stay tuned. This episode is packed with insights, expert advice, and real life examples that will inspire you to consider how chiropractic care might fit into your own wellness journey. Let's get started and unlock the secrets to whole body health through the power of chiropractic care. In today's episode, I am thrilled to welcome Dr. Anthony Rakovic, a distinguished chiropractor with over 22 years of dedicated service in helping patients alleviate the body pains and tackle the challenging symptoms of neuropathy. Dr. Rakovic brings a wealth of knowledge, particularly in active rehabilitation education, passionately advocating that the body can heal completely with the right care and attention. With a heartfelt commitment to paying it forward, Dr. Anthony generously shares his deep insights and techniques, not only with his patients, but also with fellow healthcare practitioners, enhancing the community's overall health literacy. His engagement doesn't stop in the clinic. He is a familiar face at local community events where he performs educational lectures, further bridging the gap between medical knowledge and public awareness. Dr. Anthony's expertise is broad and well rounded, having received postgraduate training in auto accident rehabilitation. He specializes in family practice, scoliosis management, child and adolescent care, nutritional counseling, and exercise rehabilitation. His holistic approach ensures that every family member, from the youngest to the oldest, receives tailored, compassionate care. Welcome, Dr. Anthony, as I call you, to the Touchology Wellness Experience.
Love it. Love the intro, Najee. Fantastic. Thank you.
You are more than welcome. But before we get started and we talk about our topic of discussion, there's always a story behind what we do. So, can you share with us the story behind how you got started and decided to become a chiropractor?
I knew I wanted to get in the healthcare field. That was my initial goal going to college. But looking into it, I go, do I want to be in a lab coat all day? Do I want to be in a hospital all day? Will it affect my personal health if I do those type of things? My maternal side has a lot of health issues, especially as we get older too. I want to make sure I could stay active and healthy as much as I could and still be in the healthcare field. And
Mm-hmm.
back then too, I wasn't very, if you want to call it people person yet. I was still kind of working on that, but I knew I wanted to stay healthy. So chiropractic was a way, like other fields, where I could work, say, 30 hours a week, make a decent income, and support my family, but still live a healthy lifestyle. That was my overall goal, besides playing golf once a week. That was my plan too.
All right. I like that. Can you explain? Let's share with us what is chiropractic care? How does it work, and what are its principles?
There's a couple things. There's a science and philosophy behind chiropractic care. The goal is to move joints. At that point, by moving the joint, we affect the nervous system
Mm-hmm.
directly. At that point, the
Mm-hmm.
body can get back to a relaxed state. That's the simplest way I can put it for one, too. So the body's in a relaxed state, it can handle the stress of our day. At that point, we don't feel like we're being stressed physically, mentally, psychologically. At that point, not take it home with us for the next day. So our body is born 99% of us in a healthy state. The problem is the
Yes.
stresses of our environment, maybe our foods, maybe a mental stress to our environment, even physical stress or injuries or trauma can make our body wear itself down over time, causing
Mm-hmm.
nerve irritation. That irritation lead to organ dysfunction, lead to brain
Mm-hmm.
dysfunction, made our body to not feel right also to even muscular skeletal dysfunction also. So the problem is sometimes we don't feel that till later on in life. We become more
Yes.
symptomatic where we feel something. So gold chiropractic to get you back to where you feel to better normal state. At that point, the practitioner part of chiropractic. The philosophy is getting the body to heal naturally for one, two. Get body to heal where it can actually heal itself. We're just a facilitator of that for one, two, like yourself too, Jika, where we do reflexology and using the body's touch and our body's motion, get it to improve over time and maintain that. The science behind
Yes.
chiropractic is using x-rays, nerve conduction velocity test also to prove that some nerves travel from some parts of the spine come out of those areas, we can root it back into the certain part of the spinal cord. At that point, treat
Mm.
that portion. So there's a science behind that to make it more valid, more, if you want to call it, more accepted in the medical world.
Excellent explanation. And one of
Simple.
the things that people don't pay a lot of attention to, and you and I understand this, is the nervous system.
Hmm.
And share a little bit to help people understand the
Good.
importance of the nervous system in our healing process.
The nervous system starts developing in the body about 7 days after fertilization, after the sperm and egg get together for one, two. That is, there's primitive ways to mention that, but it goes from your brain down to the
Mm-hmm.
whole body. It's all connected down to your skin, even also. Every cell of your body is connected to the nervous system for one, two. So it gets all
Mm-hmm.
connected, one system. If one area is affected, if I put my hand over a burning fire, for example,
Yes.
sends signals to my brain. My hand comes off that fire automatically. An autonomic system also too. Break down the different systems for one also. Because that's like an automatic system where it works automatically, such as our breathing. Okay, breathing becomes automatic if we're sleeping, if we're awake, whatever we're doing for one, two. There's
Mm-hmm.
also systems to where we can move mechanically ourselves that we get our body working properly too. We have systems that control the digestive system for one, two, our heart, cardiovascular system also. Those nerves all
Mm-hmm.
control that, and those organs send signals back to the brain through your spinal cord. That will let us know what's going on. Your brain is like your main computer system, takes everything
Yes.
in and then pushes everything out to cause more control over that. It can be affected by your hormones, your outside environment for one, too, can affect by different things in your body and outside your body to then allow it to work in the you want to call it the autonomic system to where at that point become sympathetic, parasympathetic. Very simple for one, two. The fight or flight, sympathetic is your stress response, and your parasympathetic is your rest and relaxation response. They have to be a healthy state, have to be within a balance for one, two. If it's out of
Yes.
balance, then body can start working and become more stressed over time. For example, sympathetic takes over. At that point, your organs start becoming more, you want to call it more stressed for one also
Mm-hmm. Mm-hmm.
sleep as well. Symptomatic wise, you have more pain for one, two. You're more sensitive to your environment when your body's in a stress response. When your body's in a relaxed state, they can actually work better to repair and heal. At that point, maintain that better state. So our nervous system works to control
Mm-hmm.
everything in our body so it can work properly or under stress, either adapt to that stress, get back to
Mm-hmm.
better center, or
Mm-hmm.
stay in a stress state where then our body becomes dysfunctional, where we have, for example, more pain, more insomnia, more feeling stressed all the time. Maybe certain muscles and certain joints feel that, even cause neuropathy such as headaches, finger tingling, numbness, weakness for one, two, even symptoms like sciatica down the leg. So we want kind of want be able to read your body through the nervous system. You
Mm-hmm.
understand when I'm in a normal function or in a dysfunction for one.
Excellent, excellent. What
Simple
are
ways.
some of the common misconceptions about chiropractic treatments
Chiropractic treatment.
that are important to understand?
Chiropractic care, there's so many different ways to facilitate the movement of joints for one too. So there's usually one or two main ones that versatile adjustment for one also, and also certain ones that are more, if you want to call it more hands-on adjusting for one. The
Yes.
goal of the adjustment is to really move the bones in the right direction based on sometimes we take an X-ray in our office with a scientific approach. At that point, the body can actually understand where we want to move the bones to
Mm-hmm.
unlock joints and cause more joint and individual motion. That's the
Mm-hmm.
plan with the spinal. With the spine, you have your spinal column, and at that point, over time, it can actually tighten up to cause neuropathy. Our goal is to
Okay.
unlock those areas so the nerves can work better. Then the muscle ligaments can actually lengthen and move better. Once they move better, then they actually cause normal motion. At that point, get to a healthier state and maintain that state.
Yes.
So wherever you feel right now, some people come like, I feel great, but I got adjusted. I feel even better. So wherever your default is right now, can that improve over time to better standard of health, quality of life? That way your body can stay there. But again, adding in once you've adjusted someone, the goal is not just adjust someone, boom, get out of the office. Okay, the goal is to adjust
Gotcha.
someone
Yes.
and how to incorporate certain things to stretch, flex for one also, get stronger, become more mobile, have better, and by doing that, have better sleep, feel better, feel happier for one too, and work on ourselves. That would give someone that advantage to get that ball rolling for one.
Okay, can you let's look at neuropathy.
Okay,
And what are some of the effective chiropractic techniques that are used
good.
in working with someone with neuropathy?
And going back to neuropathy, what is neuropathy? I when I talk
Yes.
to patients, keep it very simple. It's numbness, tingling, burning, sharp pain, even muscle atrophy over time from your nervous system. For example, someone come to my office, they have knee pain. Okay, knee looks great on the X-ray. Orthopedically, they're fine. It's the nerve coming from the lower back causing the knee pain. So
Okay.
what happens if you have neuropathy? Sometimes, not all the time, you can go from the spine and travel out to causing headaches, pain down the arm for one also, or numbness, tingling, burning, even problems down the leg to the feet. Okay. Doesn't
Mm-hmm.
happen all the
Mm-hmm.
time, but it can happen when we have those signs of numbness, tingling, burning, sharp pain. I go, how, where is the nerve being pinched? Meaning that that spine should have a normal position, should about the spine, normal position here. Okay. When it has that position, over time that between the bones, that disc can shrink, causing pressure on that nerve coming through that canal on the side.
Right,
And what
right.
happens, the canal on the side gets pinched. At that point, it causes the literally direct pressure on the nerve.
Mm-hmm.
That pressure can happen where it doesn't initially have to just happen. It can happen over time, causing wear and tear, causing wear and tear, causing wear and tear. Because more narrow, then over time, you can brushing your teeth can pinch that nerve. So the goal is,
Mm,
if someone says to
mm.
me they were just doing something simple, they're pinching, okay, that was going to happen. It was bound to happen. Just when was that
Interesting.
day? So if it
Mm-hmm.
was trauma, for example, a situation where someone was in an accident, at that point, okay, that accident was your initial stressor. Boom, let's get that better. Those are easier actually to treat. Someone that has
Yes.
chronic problems where now it just happened to them, they just woke up today and just happened to have back pain. That okay, let's figure out what the cause is. X-ray for sure,
Mm-hmm.
figure out
Mm-hmm.
what's going on inside. That look for that wear and tear of that disc and that spacing decreasing over time. That canal closing off over time too. That point it pinches, pinches, pinches. Boom, let's find that one. But we're gonna also get the whole spine too. Like we talked about before, you got is the whole spine, the whole person. That point, how's their posture? What's your job position?
Okay.
Do you move a lot?
Yes.
Look at the
Mm-hmm.
whole person. What may be in the initial cause long term where now they're feeling the problem. Especially during COVID, people sat a lot. They sat a
Mm-hmm.
lot until they had pain. So that
Mm-hmm.
point, figure out how do you correct their problems in their spine, their immobility by having better position your posture. If our posture is off or too far forward, too far hunched forward for one
Yes.
example, that point the spine will lock and not move properly, causing pinching the nerve. Can we get the
Mm-hmm.
body to open up, get someone to reset their posture? That when they know how to reset the posture, I give them some exercises or doing it at home. That when they can reset their posture so they know where normal should be. That when they maintain it over time becomes their normal again, their ideal normal, not just their normal, and reset that.
So, in addition to that, how does chiropractic care integrate with other holistic practices.
Good. I love massage for my patients for one, too. It
Mhm.
helps them if you want to call it, and we all both know this. When I move my joint, okay, I can move that so far that my body goes, we're gonna stop right about there. If I have someone else do it for me, they can go a little bit further than I would, especially if I'm in a relaxed state. At that point, I get more motion, more lengthening of the muscle, more loosening of the joint for one also. At that point, the body works great from the outside in to move things that
Yes.
I can't move on my own, which is phenomenal. Okay.
Mhm.
Getting things to actually change. For example, physical therapy, same thing also. Can I get people to understand that they can move further than they normally can, get them to retrain their habits. At that point, they start doing things differently,
Mhm.
almost should be outside their comfort zone. I would talk to patients all about the comfort zone is where you are now. If I show you stretch, I want to see your face. When it does this, at that point,
Mm.
I know that you're outside your comfort zone. Can make that
Got
your
you.
normal over
Yes.
time.
Hmm.
That's your normal.
Hmm.
Then we get to a better normal. Then we get that to become your normal. Then we go to another normal. So I want them to progress to where they understand
Mm-hmm.
sometimes being comfortable is a way to stress the body in a good way. That's when they actually improve their overall health.
I like that approach. That's an excellent approach because that helps your patients actually see what's going on in the process, which leads to my next question. What role does self-help play in dealing with chiropractic care and just treatment as a whole?
A lot of it is going to be the initial, they come in scared, right? Okay, do I have a problem to where if I do too much, I might hurt myself? The difficulty is they've come in already maybe dealing with a chronic pain of maybe more than 3 months or so, not getting better. They may have seen their doctor, medication given them hasn't worked for right now. They
Mm-hmm.
may doctor may require looking into either shots, recommending shots or surgery for them too. They're going, okay, let's back it up a little bit. What is really going on? So they've now
Mm-hmm.
limited their normal lifestyle to avoid pain. Most cases. Okay.
Mm-hmm.
It's a chronic pain case. At that point, I want to take an X-ray of them, do an exam on the one too. I want to show them how much the range of motion is in their overall body to give them either the pause yellow light. We're going to work on this first, get things moving for one, two, work on range of motion, calm down neuropathy. Then from there, give them the green light to start stretching more. Then the
Okay.
self-care starts coming in for one, two. Once
Okay.
we calm down neuropathy, where the tingling, burning numbness has kind of minimized or is no longer there, then work on more stretching. I give them stretches off the day one, day one. I want them to start learning a habit day one. Once you've gone there, okay,
Yes.
how do we start incorporating more maybe just body weight lifting for right now? Two, maybe some walk, maybe some movement to build some strength. Because I want the active rehab. I want them to feel I can do more now, so their mind thinks, hey, I'm no longer limited.
Yes.
I can actually do more.
Yes.
The hope is there
Yes.
again. I can get back to lifting my
Yes.
kids, back to walking 20 minutes a day. I can back to getting out of bed without feeling I'm in pain. The anxiety is there. If we remove that, then we give them hope. That's when they go, I can do a little bit more, doc. What else can I do? And I know I got them. Once I got them, I can start walking more, maybe lifting weights, maybe doing some more stretching, maybe joining a yoga class, maybe doing more things outside their own ability that they thought they could do. At that point,
Mm-hmm.
they know they're better. That's my big. I want them to know they're better because they're in the active rehab. Now the adjustments has helped them get to that point. We maintain that so that they get to better state of health. Over time, their physiology changes. Long term, then they want to maintain that better position.
What you have just shared, I find to be a real key point as we talk about patient clients
Huge.
connecting with the practitioner. And that seems to be a missing piece because that is ultimate in the healing process. And the strategy that you just shared focuses on you and your patients are coming together in oneness in the healing process. And that's very important.
And it doesn't have to be that difficult either. I basically see my patient. I show him some stretches and I send him the videos afterwards. That takes
Okay.
2 minutes. Doesn't take very long. But you don't have to, and I tell people, you may not have to go schedule a physical therapy appointment 3 weeks from now and hope they help you and then get an appointment that week. It's almost, I'm trying to make sure they're efficient time with me so they have homework every time.
Oh, I like that homework. Yes. Mm-hmm.
It's good homework because it gets them healthier. They get them to go, I'm going to see you next week, but by then I want you to make sure you do your stretches at least 3 times, go for 2 walks. When you come back, I'm going to ask you about how you felt. They go, oh no, I have to be, I'm making them accountable for their health.
Yes, yes,
Not my health. I'm
yes,
fine. I work out every day. But can I make them
yes.
accountable so they understand I can't do the stretches for them? They have to do them.
Perfect, perfect, perfect. That's the ideal model, really.
Dude,
Very important.
it's,
Now, as
I think
we,
it's, yeah, go ahead, good.
no, go ahead, go ahead, come on your comment.
Almost you got to make it full circle for me. I gotta go, okay. When I see someone, they go, man, I haven't been able to lift my daughter for 6 months because of my back pain. I
Yes.
go, that's my goal. So you can lift your daughter and not feel like you have a problem anymore. I want to find what their loss is and what's the emotional,
Excellent. Yeah, excellent.
if you want to call it the emotional and physical commitment that they want to regain, that point they know they're better.
That right there leads into, I mean, you just pretty much shared chiropractic care relating to stress management and emotional health, because
And when I
that's
tell
what it's really all about.
And I tell them that I'm not a doctor's going to tell you if you're stressed, if your family stresses you out, leave your family. If your dog's stressing you, leave your dog. If your job stresses you, leave your job. I've had patients come to my office. Their medical doctors told them, well, your job's stressing you out, just leave your job. I'm like, you're just cause someone more stress than help them out with their
For
stress.
real.
Can we make their body better so mentally, physically, they
Yes.
have more energy, they're more positive to now maintain a lower level of internal stress. So then the stress outside of them doesn't make it boil over. So now it affects their body.
Exactly. Exactly.
It's not that difficult, but it is work. It is work. So we have to be able to want to do the work.
And see, that also leads into, because when we, as healthcare practitioners, we
Mhm.
understand the stress pain connection, but our patients do not understand that. And it's important for them to know that that pain stress connection go hand in hand in leading you to your health and wellness. Can you speak on that?
I did an interview with a Dr. Verzal. He's in Orange County down here. And he talks about pain or headaches being a good sign. Where they are. Are they side of the head? Are they eye headaches? Are they back here? That's telling you what the problem is. When you can trace that problem back, then you know how to fix the problem. So the x-rays we
Yes.
take, the exams we do for one too, are if you want to call it in-person questionnaire for one also, my visit with you for the 5, 10 minutes I'm with you that whole time, I'm in my head have a calculator going, what else can I give them? What else I can do to get their health a little bit better? And
Mm-hmm.
realizing pain is your sign where it is, how often it is, what type of pain it is, or is
Yes.
it neuropathy
Yes.
also, tell us
Yeah.
once it gives us the proper diagnosis then we can actually treat that, give you the proper treatment plan, the most efficient one to get your body healthier.
That's true. That's very true. And that's a good point in terms
Huge,
of
huge.
having that process in place.
It's
What
almost
if
like if someone
mhm,
comes up with it and goes, I have leg pain down my right side. It caused numbness to my feet, but only when I get up in the morning. I'm like, perfect. I know 9% of your diagnosis, but I now want to test my diagnosis based on x-rays, based on examination, based on even treatment to know if it's the right one for you. Then we move on with how to get yourself better today. Instead of a 10 out of 10 being pain level, now down to a 5, down to a 4, then
yeah.
long term get your body health so it goes away and stays away. And again, a lot of it is based on that diagnosis. But if you go,
Yes.
your diagnosis is right, but they're not getting better, what are we missing? Do we need an MRI? Do we need other testing for one too? What are we
Yeah.
missing?
Yes.
So
Yes.
it's a continuous live diagnosis, not like boom, you have next 6 months. No. If your symptoms change, if your body doesn't respond to this, we move on to second diagnosis. Then we look for more, if you want to call it more imaging per se, or more testing to make sure we get
Yes.
you better long term.
What advice would you give someone who is looking, who may not have had chiropractic care and is thinking about starting chiropractic? What advice would you give them? What do they need in terms of beginning adding chiropractic care to their treatment process?
It's finding a chiropractor. I like the referral. That's always the best. Even going online, seeing the reviews also to
Mm-hmm.
get how people like that office. You know, because when you see a chiropractor, you're seeing the chiropractor. They're gonna
Yes.
get it's working with people. It's very personal, professional. At that point, the reviews are gonna have will say if they like them or not like them. For one, you got to always make your judgment too. Then once you've done that, and then go and see the chiropractor, do an interview. Yeah, I had this problem. What do you think? And then you don't have, and really beyond, unless you take x-rays or exam or other stuff too, you may have to pay an exam fee, which could be $100, under $100. See if they actually listen. Okay, I do a talk every a month or so for the state, a relaxing seminar for one too. We talk a lot about how are we different than medical doctors. We're hands-on, so it's very
Mm-hmm, mm-hmm,
person with a
mm-hmm.
person. And then in the sense where does the person can you by a 5 minute interview with the doctor, can you trust that doctor? No, medically we feel like
Ah,
we have to go see Dr. Smith because that's under insurance company. Chiropractors are if they're in network out, it doesn't matter. For one, two, there's options for you for one, two. Does the person actually listen to you? Do you feel comfortable with the
yes,
person? Do your
yes.
personalities match to where you can say, I have this problem, doc, what do you think? And trust their opinion for one, two. You know?
Perfect,
If
perfect.
you've been on this planet more than say 18 years, I can almost certain that you have that instinct where you like this person, I can trust them, or I don't like this person.
Mm.
That's what
You
I would do.
said you said the key word trust.
Hmm.
That is valuable, in terms of any type of interaction that we do. It's got to be a trust factor that needs to
Huge,
be there.
huge. And you can look at someone's reviews online with reputation that way, but unless you meet to someone, you don't really get to know them. So give yourself time
Yes,
to find the right chiropractor. When you're desperate, the problem is now you're going to go anywhere you got to go, whatever's open
yes,
for you. Then
yes.
you're stuck, but then you have to go see Johnny or Dr. Johnny because he's only up on Saturday. You know,
Right,
my
right.
office we have about a week waiting list to see us because we're just busy. You know, so a lot of it is
Mm-hmm.
get someone. So you have say for example, I tell someone classic case that is I tell someone that you've seen me before, so you're doing well now. Okay, if you have a pain that lasts more than 3 days, not getting better, at that point, worse in the morning, see a chiropractor right away. That
Okay.
means something's locked up inside. Your body's not able to unlock it itself for one, two. Your body's kind of stuck. So
Yeah.
you can wait 3 days. That point, come in. That point, get treatment, do an examination, whatever you got to do. That point, take care of that minor problem. The problem is
Right.
most people wait or see a medical doctor and hope that they get them better. They wait
Mm.
sometimes 3 months, 6 months, a year.
Yes.
Now, like, okay, now take care. I always ask them, how are you so optimistic this can go away on its own? You know, I don't have that optimism. I'd rather just know. So once you see my office, they would understand, okay, I feel better now. This is my standard normal. This is where I should be and stay here. When I feel off, when I feel like my problem's coming back again, whatever the problem their symptom might be, then we go see the chiropractor within 3 days.
Yes. Yes.
That's my judgment call in the sense where it gives someone an idea. Because some people come in, may not realize they have a neck problem because their fingers go numb. I go, so Mary, when your finger goes numb, that's how you know more than 3 days, getting worse in the morning, worse when you're sleeping for one, two, see me right away. So I give that person their if you want to call it not first aid kit, but their sign, okay, I'm gonna go see a chiropractor because I have this thing.
Now, what you just said there leads into my next question. Here's
Hmm.
a word that it was used a long time ago, but it's not even talked about now, and that's called preventive health care. What you just shared was all about that. How does chiropractic care relate to preventive health care? Where does it fit in that role?
In all parts of it for one, two. We can get you to where at that point with again proper exam, x-rays if needed for one,
Mm-hmm.
two, proper care, sometimes short term, long term, get you to where then you feel better. Once you
Mm-hmm.
feel better in better state of health, how do you maintain that? Maybe the stretches we showed you, maybe other lifestyle choices also you want to change to get healthier from one also. But once you've seen a result and spend the time to really kind of look at your life from the outside and go, how do I change my life to where now this doesn't come back again? That may take 2, 3 months. But once you've
Mm-hmm.
gotten there, then your body's at a better state of health physiologically. That's enough. That's
Yes.
for most people enough time for one too. And once you maintain that, once it gets to where instead of feeling great, whatever your grade is, we start feeling, start feeling, that thing that didn't stress me out last week, now why is that stressing me out? Why do I feel I can't wake up? Why do I feel I don't sleep very well for one, two? Why do I wake up like
Right.
lack of energy, lack of just, I don't feel like I'm doing really well. At that point, then we get you to where once you feel that, again, that symptom, at that point, let's get you back in to get you back to better state of health before your body changes back to what it was before.
Yes.
People wait too long, their body will learn how to deal with the stress
Yes.
at that point make you feel okay, but long term causing more problems such as degeneration, arthritis, just a bunch of fascia and scar tissue, which you don't want.
Exactly. Exactly. Let's look at, because your practice covers family.
Yes.
What are the various chiropractic treatments that you would suggest or that you provide that's related to ages and, whether they are seniors, whether they are youth, uh,
And
from infants to children, from infants to seniors.
got
What kind of treatments do you provide?
If anything, we do limit our care to that people or humans that can walk. Okay, so I want babies. We have a local Dr. Jared's really good down the street. He's a pediatric chiropractic. He's phenomenal with children for one, also. But once
Mm,
they can walk, we can help parents understand, especially parents, how to help your children by seeing a chiropractor that's going to help you train as a parent what to look for. So
mm-hmm.
a kid comes in. He's leaning to one side. I'm going to go because more commonly, lean to one side, upper back pain. Okay. At that point, she's say junior high or high school for one. Also, even younger, we take an X-ray, scoliosis. The body's
Right.
leaning one
Mm-hmm.
way for one, two, and I'll tell, and I want the parents in the room to tell them exactly what's going on because the parents are still the guardian at that point to understand what the spine has shifted to, how we're going to shift things back with office care, but also home care too. And I tell the parents, I want you to check your daughter or son out every night. At that point, look at their back and see where they are, and make sure. And you don't have to do them. You don't have to make sure every day, but make sure there's stretches every day. And I tell them in
Okay.
front of the parents too. I tell them in front of the kids is I go, it's not your job to make sure your kids do your stretches. If they want to get better, they have to do the stretches. I'll put on, even though the child may be 8, 9, 10 years old, they're in pain. The pain
Yes.
will make them alert. They'll go, if I do the stretches, I'll feel better. So I want
Exactly.
them to realize it's
Exactly.
up to them, not me. I remember one kid came in and was, I want just being a kid, right? He goes like, I do my stretches. I'm like, that's fine. I don't have to do them anymore. Like, why? I'm not going to see you anymore. He goes, well, like, why not? Well, I can't help you unless you do your homework. And he goes, well, I go, you know what? I'll give you one more chance. I'm going to call you 6 o'clock tonight. And if you can do stretches by then, don't worry about coming in next visit. Kid's like, oh, okay, whatever. Next comes in a couple days later. Couple later, we go, hey, why? He goes, hey, why didn't you call? Because I know you do your stretches. I know you want to get better. I just had you motivate a little bit more for one, two.
Right. Right.
And I tell parents like it's going to take some time. Watch your kid. I want them to understand they're their best doctor at this point. So
Good
use your common
point.
sense, use your knowledge.
Yeah.
We're looking for. At that point, I want them to feel this. Ask them this question. At that point, make sure we're on the same page. So it has to be that. Once you get to where adolescents become, say, 20s and 30s, even for example athletes in high school,
Mhm.
it's
Yes.
more of what's going on there. Was there an injury say 6 months ago where they never really healed properly for one?
Mm-hmm.
Also
Mm-hmm.
you want to play
Mm-hmm.
sport again, their doctor says they're okay, the physical therapist is really good, but they still have keeps coming back and back and back. So I want to backtrack
Right.
with them and the parent again, the parent also too. Where's the injury point? Take an x-ray,
Right.
examination, check range of motion for one, two. Then I'm going to go, okay, this is what's going on. You've lost motion here. Let's correct that motion, say internally. But next year, we're going to start doing more stretches here, here, and here. We're next to a high school. The physical therapist would call us every Friday night at football game and go, okay, I'm sitting in Johnny because he hurt his back. Sitting in head because he hurt his ankle. For one, two. So
Right.
I
Right.
want to do the exam so they see I want you back on the field, but I want to make sure your body's right. What I worry about a lot of wrestlers too. Wrestlers get their head hit a lot of neck rolls,
Yes.
and like that.
Yes.
Also, concussion protocol. So, and again,
Yes.
these are parents that already brought their usually their child to a doctor, their kid to a doctor. Doctor saying he's okay, but the mom or dad knows he's not okay.
Right.
So I want to
Right.
give them evidence to show them why they're not okay, or if they are, at that point, how do we correct those problems so they see those problems improve?
I
That's
think that is excellent because when we start looking at children today,
hmm
and they are under stress in addition to health issues. And I think it's so important for parents to know how to introduce your children to some of the same practices that you are using in your health regimen. And what I think is going to be, from what I see, a future approach of this, like with your style in terms
Yep.
of how you work with the children, it now prepares them to really move into preventive approaches to healthcare as they get older. And that needs to be the foundation.
And it lets the child know too. Hey, it's okay to let your parents know when you have pain here. It's okay to let your
Yes.
coach know you have pain here. You may not see
Yes.
that at one game, but you want another hit where now you can be out for a whole month.
Right.
Maybe longer than that too for one also. So I want to
Right.
let them understand there's a range we're looking for, and if we catch it early enough, we can treat that, get back to the field right away. That point,
Yes.
the guys go right away. At one kid, he was wrestling a weight class up, and just getting beat up, headaches,
Mhm.
eye pressure, everything. Got it under control and go. Okay, now I want you to go back to wrestling, but let's watch these symptoms, see how you progress. So a lot of it is helping kids understand at their level. When I talk to someone, I kind of figure out where they are. I want
Yes.
to meet them where they are. Not the point, give them information so I see them do this, nod their head when I talk to them. So I see them understanding it so they can
Yes.
progress to now doing the things I want them to do at home to get themselves better. Or at school or whatever it might be, even talking to your coach
Yes.
also. Okay, I need your kid, I need this student, this athlete to maybe take some time off or work on this, and this so we can get back on the field, get back to work with you, but I want them better first. And I don't get a lot of pushback because coaches especially they have the best reason for being the kids, right? Is they want the kids to do well. And a lot's going to be
Yes.
if this isn't working properly, they feel like this is off. What else is going on for one too? And you mentioned
Yes.
too is they feel stressed at school. What else might be going on to make them feel not right? I have people who can come in be diagnosed with ADHD, correct? So they're given a
Yes.
bunch of medication. Parents go, I don't want my kid on medication. I'm like, I can help their nervous system, but there's other things going on. I'm not going to be able to help them. Let me do my job and see that it does help them. So I want to make
Yes.
sure I give myself very specific parameters, expectations for parents in a window of time, so I'm being more transparent with them also.
Now you brought up ADHD. That's interesting because that seems to be the biggest thing with children in schools. How does chiropractic work with that?
It's lifestyle changes, it's
Okay.
diet, it's if they're having headaches, nervous system improvement for one too, posture improvement for one also. Exercise, because exercise will do what? It'll help balance out the nervous system to feel less
Yes.
movement, movement, movement. So I want them to feel they're doing things for me as their coach per se. So when I see them in a couple of days, they've done that checklist. I may even have them printed out something that they go, I'm gonna do this, and this, so I know we're getting some improvement. And I want the parents to say, I want you to watch your kid when he does this, and this, and let me know how they're doing based on your perspective.
Right.
So
Right.
it's a dual effect of I'm not treating just your kid. I'm helping you understand how your kid's improving or maybe not improving. And how do we now alternate plan B if need be to get them over time better so they see the improvement.
Yes. But you said something that's real key as it relates to ADHD, and that's movement. And
hmm
that is something that's not happening with the children who are diagnosed with that in school because that's the one thing they want to do is move.
hmm
But the restrictions kind of hinder them from being able to do the movement because that's not understood.
So it's almost like okay, if the school's going to restrict what we're going to do, we're going to start a little workout program before you go to school and before you go to bed, same thing. To calm nervous system down so you wake up
Okay, good.
balanced out.
Okay,
So I give
okay.
a 10, 15-minute little workout they can do at home. Boom, boom, boom. At that point, we know your body is rested for school. Come home and do the same thing.
Excellent. That makes a lot of sense. And that is real key. Tell me, what about the latest research in chiropractic that chiropractic care now that you're seeing that's exciting you?
A lot of it is understanding that there are certain, if you want to call it more the philosophy of chiropractic, is integrating that with physical therapy, with nutritionists for one also,
Mm-hmm.
reflexology for one, and incorporating those factors into someone's overall healthy lifestyle for one. So it's not
Okay.
just chiropractic, it's how it all works together. So that when the person can improve their overall health, their well-being, get to a higher state of health and maintain that with what they're doing at home. And everyone's different, right? They may be able to eat certain foods, but maybe not certain foods. And I'm not someone to say, go get a blood test, go do this, but realize whatever you're going to do, when you pay for something, you're going to pay attention. So can we do
Yes.
enough things to understand where your body is and realize your medical doctor's blood work may not be the best for you because it may show you're fine. The problem is their fine is not your fine. So how do we get
Yes.
your fine to a better normal by maybe sending you out for this type of blood work, for this type of an X-ray imaging for one too, to this mobility testing for one
Okay.
also. So
Mhm.
doing more work in the sense where once you get that all done, they can make it very simple for them to understand how you're going to stay healthy, feel healthy, and know when you're not healthy.
Exactly. Oh, you have shared so much, and we've come to
You
the
know,
end. But before I cannot let you leave without telling us how we can connect with you, if you have any programs or trainings coming up, just how do we get connect with you?
if you know where Upland, California is, I have a local office here at Euclid Chiropractic. I've been here, it's been in office since 1983, I think. I'm the
All
fifth doc.
right.
We've done a good job with our patient base. We have a good, I guess 50% comes from referral for one, too. You can find me online on my YouTube, same name, Euclid Chiropractic. You can look up Dr. Tony for one also. And Dr. Tony Chiro, Chiro, is my handle for Instagram and Facebook and TikTok. As it's back again, too.
Well, I definitely will share that with the listeners. And all I can say is thank you. And as we wrap up today's enlightening conversation on Beyond the Back, chiropractic care for whole body health, it's clear that chiropractic care extends far beyond simple back adjustments. We've uncovered its profound impact on overall wellness, from enhancing nervous system function to improving immune responses and even boosting mental health. Our discussion with Dr. Anthony has illuminated the holistic benefits of chiropractic adjustments and underscored the importance of integrating these practices into our daily health routines. For those of you inspired to explore the chiropractic care benefits and how it benefits your life, we encourage you to seek a qualified chiropractor with experience and trust firsthand on the profound and significant health transformations. Thank you, Dr. Anthony, for being my special guest today on the Touchology Wellness Experience. As I thank you, but I want you to leave some closing words. What closing words do you want to leave for the listeners?
Never stop learning. Never stop learning about how to help yourself stay healthy. We talked about in our show earlier is about making sure we show gratitude every day, start in a
Mhm.
positive way, and make sure we help ourselves first, physical, mental health. That point, when we start our day that way, we can help everyone around us. So, and if you want to go to my YouTube channel, also, I have a bunch of videos how to stay healthy, about chiropractic, about my office, about other
Yes.
people. Like Najita Tui did a talk, I think a show about back in November, December. Same thing. Learn about how to keep yourself healthy through chiropractic, through flexology, through anyone in your area that can help you relearn and learn how to keep yourself healthy.
Thank you. And through our discussion, it's evident that chiropractic care offers a gateway to enhancing overall psychological health, improving everything from immune function to mental clarity and emotional well being. The holistic approach not only alleviates physical ailments, but also promotes a balanced lifestyle, emphasizing prevention and natural health. As we close this episode, we encourage listeners to consider chiropractic care not just for acute issues, but as a regular part of your comprehensive health maintenance regimen. Embracing these practices can lead to substantial health improvements and more vibrant, pain-free life because the power of touch heals all.